All right, so get ready because today we're diving into a topic you might not think is all that exciting at first, but trust me, it gets pretty interesting. Oral hygiene.
Yeah, it's a lot more than just brushing and flossing, that's for sure.
Right. We're going deep into the history and science of it all based on this book I found.
Oh, cool.
Yeah, and it turns out that oral hygiene is surprisingly connected to our overall health in some pretty amazing ways.
You know, it's easy to forget how much goes into taking care of our teeth these days. We've got toothbrushes, toothpaste, floss, mouthwash. It's a whole thing.
I know. But it wasn't always that way. The book actually talks about how ancient Egyptians used crushed eggshells and animal bones in their toothpaste recipe. Can you imagine?
Wow. Talk about resourceful, huh?
I know, right? It's amazing to think about what people used before modern dentistry.
And you know what's interesting is that crushed eggshells they were using actually provided calcium, which is still essential for strong enamel today.
Oh, so they were kind of onto something, even without all the scientific knowledge we have now.
Exactly. I mean, they didn't have microscopes to see bacteria or anything like that, but they recognized the importance of oral care. It just goes to show that the pursuit of oral hygiene has been a constant throughout human history, you know?
Totally.
Well,
Okay, so fast forward a few centuries, and the book mentions this crazy trend of aggressive brushing in the 19th century. It's like people thought the harder you scrubbed, the cleaner your teeth would be.
oh yeah, I've heard about that. But actually that led to a lot of problems like enamel erosion.
Oh, wow. So it's not just about brushing, it's about brushing the right way.
Exactly. Dr. J.N. Demerit, he was a dentist back then, realized that all that force was doing more harm than good. So he started advocating for a gentler approach, focusing on thoroughness instead of like brute force.
Makes sense. So softer brushes is the way to go.
Yeah. Think of it like sweeping a delicate surface, you know? You wouldn't use a harsh broom, right?
Okay, that's a good analogy. And speaking of things we don't normally see, the book dives into this whole world of bacteria living in our mouths. Apparently, there are over 400 species.
Yeah, it's crazy, right? Like a whole ecosystem just hanging out in there. But not all bacteria are bad.
No, that's right. So it's not like we're trying to eliminate all bacteria, just the harmful ones.
Right. A healthy mouth has a balance of good and bad bacteria.
Okay, so it's like a microscopic battle going on in there.
Yeah.
And what about the role of sugar in all of this? I'm guessing it's not helping.
Oh, yeah. Sugar is like fuel for the bad bacteria. It helps them multiply and produce acids that, you guessed it, attack tooth enamel.
So it's not the sugar itself that's directly causing cavities, but it's kind of setting the stage for it.
Exactly. It throws off the balance in favor of the bad guys.
Wow, this is getting pretty complex.
Yeah.
It's making me realize that there's a lot more to oral hygiene than just brushing and flossing. We're talking about maintaining a whole ecosystem in our mouths.
It really is. And that's why understanding the science behind it all is so important. It helps us make informed choices about our oral health.
Okay, now this is where it gets really interesting. The book mentions a link between oral health and systemic diseases, like heart disease and diabetes. I'm not sure I fully understand the connection.
Yeah, it's a bit mind-blowing. It's not a direct cause and effect, but rather an indicator of overall inflammation and immune response in the body. So think of it this way. Your mouth is like a gateway to your body, right? So there's inflammation in your mouth. It can actually be a sign of inflammation elsewhere in the body, and that can contribute to those chronic conditions.
So taking care of our mouths isn't just about having a nice smile. It's about our overall health and well-being.
Exactly. It's all connected. You can't have one without the other.
That is blowing my mind. I never thought about it that way before.
It really puts things into perspective, doesn't it? Even something as seemingly simple as brushing your teeth can have far-reaching effects on our health.
All right, so we've covered ancient toothpaste, aggressive brushing, the bacterial battleground, and even the mouth-body connection. Where do we go from here?
Well, the book takes us on a journey through the evolution of dental care, highlighting some of the key innovations that have shaped the field. You know, from twigs to toothbrushes, from oyster shells to toothpaste tubes, it's quite a story.
Okay, I'm ready for a history lesson.
All right, let's dive in. Welcome back. Last time we were talking about how our mouths are these like little worlds of bacteria, some good, some not so good.
Yeah, I'm still kind of wrapping my head around how important those tiny bacteria are for our health. It's wild.
It really is. So let's talk more about how we can actually support those good bacteria and keep the harmful ones in check. The book spends a good amount of time on diet, which makes sense, right?
So we all know sugar is bad for our teeth, but what's the actual science behind it?
Well, when you eat sugary foods, those harmful bacteria in your mouth go crazy for it. Like it's a feast for them. They basically ferment that sugar and make acid as a byproduct.
So it's not the sugar itself drilling holes in our teeth. It's more like
The sugar empowers the bacteria to become little acid factories. And the longer those acids sit on your teeth, the more damage they can do.
Yikes. Okay, so we'll limit the sweets. But are there other dietary villains we should be aware of?
Absolutely. Acidity is a big one. Foods and drinks that are acidic can also wear down enamel even if they don't have a ton of sugar.
Like what kinds of foods?
Think citrus fruits, sodas, some sports drinks. They might be tasty, but they can wreak havoc on your teeth if you're not careful.
So it's like an acid attack on our enamel.
Exactly. And it's not just about what you eat, it's how you eat it. Like sipping on soda all day is way worse than having it all at once because you're constantly exposing your teeth to that acid.
Makes sense. So watch the sugar, be mindful of acidic foods. Anything else we can do to protect our pearly whites from all this dietary damage?
Actually, chewing sugar-free gum after meals can be helpful. It gets your saliva flowing, which helps neutralize those acids and wash away food particles.
It's a little rinse cycle for your mouth.
Exactly. Plus, saliva has minerals that can actually help remineralize enamel, strengthening those areas that have been weakened by acid.
Wait, remineralize? Our teeth can actually repair themselves.
To a point, yes. When the pH in our mouth is balanced, saliva can deposit minerals back onto the teeth. It's kind of like patching up those tiny holes.
Wow, I had no idea. Our bodies are pretty amazing.
Right. Okay, so diet's obviously a big factor, but I'm guessing there's more to the story, like lifestyle choices and stuff.
I was just thinking that. The book mentions smoking, for instance. I mean, it's bad for everything, right?
Pretty much. But in terms of your mouth, smoking increases your risk of gum disease, tooth loss, oral cancer. Plus, it stains your teeth and slows down healing.
Okay, so smoking is out. What about stress? Can that really mess with our mouth?
You bet. When we're stressed, we tend to clench our jaws or grind our teeth, which wears down the enamel and can lead to jaw pain, headaches, all sorts of things.
And stress weakens the immune system, right?
Exactly, making us more vulnerable to infections, including those in our mouth. So yeah, stress management is a big part of both mental and oral health.
Okay, so I'm adding stress management to my oral hygiene routine. Haha.
Good idea. Even small changes can make a big difference. Now, this might sound kind of out there, but the book also mentions genetics. Like, can our genes really make us more prone to dental problems?
That's interesting. I wouldn't have thought about that.
Right. But it turns out that just like some people are genetically predisposed to certain diseases, our genes can influence our susceptibility to tooth decay, gum disease, even the shape and alignment of our teeth.
So even if you have perfect hygiene, some people might be fighting an uphill battle.
Well, that's not to say that good hygiene isn't important, but it does mean that some people might need to be extra vigilant, especially if they have a family history of dental problems.
So knowing your family medical history, but for your mouth.
Exactly. It's super helpful to be aware of that and share it with your dentist.
Okay, that's good to know. So let's shift gears a bit. The book also dives into the history of dental care, and it's pretty amazing to see how far we've come.
It really is. We've gone from chewing on twigs to using electric tooth, from concocting homemade toothpaste to having a whole aisle dedicated to oral care products at the store.
I can only imagine what those early dental practices were like.
Well, let's just say they weren't for the faint of heart. Before anesthesia, dental procedures were incredibly painful.
Ouch, I can't even imagine.
Yeah, it was a different time, that's for sure. But those early dentists were pioneers in a way. They paved the way for the modern dental care we have today.
So when did things start to resemble the kind of dental care we're used to now?
The 18th century was a big turning point. Pierre Fauchard, a French surgeon, is often considered the father of modern dentistry. He emphasized diet and hygiene, debunked myths about toothworm, and even invented new tools for treating dental problems.
Wow, so we owe a lot to Monsieur Fauchard.
We do. And the innovations kept coming after that. The toothbrush, as we know it, came along in the 19th century. Fluoride was discovered in the early 20th century, and the electric toothbrush hit the scene in the 1960s.
It's amazing to think about all the progress that's been made.
It is. It's a testament to human ingenuity and our constant search for better health. Okay, are you ready for a little dental history lesson?
Bring it on. I'm all ears.
All right, let's start with the toothbrush. Remember how we talked about people using all sorts of things to clean their teeth before the toothbrush was invented?
Yeah, like twigs, cloth, even fingers.
Exactly. The first actual toothbrushes, with boar bristles, appeared in China around the 15th century, but they didn't become widely used in Europe until the 18th century.
Wow. What about toothpaste? Did ancient civilizations have their own version?
They did. The ancient Egyptians, for example, used a mix of crushed eggshells, animal bones, and mint. The Romans used powdered oyster shells and animal bones as well. And the Chinese favored a blend of ginseng, salt, and herbs.
Some of those ingredients sound a little rough on the teeth.
Haha. Yeah, they were a bit abrasive, but hey, at least they were trying. It wasn't until the 19th century that toothpaste started to resemble what we use today.
So when did fluoride enter the picture?
Fluoride was discovered in the early 20th century, and scientists quickly realized It could prevent tooth decay. It basically works by making tooth enamel stronger and more resistant to those acids produced by bacteria.
I've heard some people have concerns about fluoride. Is there anything to worry about?
Yeah, there have been some concerns raised about potential health risks if you get too much fluoride. But the levels in drinking water and toothpaste are carefully controlled to minimize those risks. The benefits of fluoride in preventing tooth decay are well established.
So it's all about balance, like with everything else.
Exactly. And you can always talk to your dentist if you have any concerns about fluoride.
Good point. Okay, let's talk about something that's not exactly a pleasant topic, but super important. Gum disease. It's not something we like to think about, but it's something we should definitely understand.
Absolutely. Gum disease, also known as periodontal disease, is an infection of the gums and the bones that support our teeth. And it can be pretty sneaky in its early stages. That's why regular dental checkups are so important.
So what actually causes gum disease? Is it just not brushing and flossing enough?
Well, poor oral hygiene is a big part of it. But there are other factors too. Genetics, smoking, hormonal changes, certain medication. All of these things can increase your risk.
So it's more complex than just forgetting to floss a few times. What are some signs that we might have gum disease?
One of the biggest red flags is bleeding gums, especially when you brush or floss. You might also notice your gums are swollen, tender, or receding. Or you might have persistent bad breath or even loose teeth. Any of those signs, you definitely want to see a dentist right away.
Okay, got it. So let's say we've been slacking on our oral hygiene and we end up with gum disease. What happens then? Can it be treated?
It depends on how severe it is. Early stage gum disease, called gingivitis, can often be reversed with professional cleaning and better oral hygiene habits. But if it progresses to periodontitis, the damage becomes more serious.
Uh-oh, that doesn't sound good.
Yeah, it's not ideal. Periodontitis means the bone and tissue supporting your teeth are being destroyed, and that can ultimately lead to tooth loss. Treatment might involve deep cleaning, medications, or even surgery.
Yikes. So early detection is key.
Exactly. Early detection and treatment are crucial to preventing permanent damage. And here's another reason to take gum disease seriously. It's been linked to other health problems like heart disease, stroke, even premature birth.
Wait, gum disease can affect our overall health that much?
It can. The bacteria that cause gum disease can enter your bloodstream and travel to other parts of your body, triggering inflammation and potentially leading to those conditions. It really highlights how interconnected our oral health is with our overall well-being.
Okay, I'm definitely going to step up my flossing game after this.
I'm glad to hear it. Remember, a healthy mouth means a healthy body.
So true. Okay, let's switch gears now and talk about cosmetic dentistry. Teeth whitening, veneers, all that good stuff.
Sounds good. Cosmetic dentistry has come a long way. And it's not just about vanity anymore. A lot of these procedures can improve oral health and function too.
Okay, let's start with teeth whitening. What's the science behind it, and what are the different options?
Basically, teeth whitening uses a bleaching agent, usually hydrogen peroxide or carbamide peroxide, to break down stains on the surface of your teeth. You can have it done professionally at the dentist's office, or there are at-home kits you can use.
What's the difference between those two?
Professional whitening usually uses a stronger bleaching agent and can give you more dramatic results faster.
Yeah.
At-home kits are more convenient and affordable, but it might take multiple applications to get the shade you want.
So it's like a trade-off between speed, cost, and results.
Exactly. And it's always best to chat with your dentist first to figure out the best option for you and make sure the procedure is done safely and effectively.
Good advice. Now, what about veneers? What are they, and who are they for?
Veneers are basically thin shells made of porcelain or composite resin. They get bonded to the front surface of your teeth to make them look better, so they can fix chips, cracks, discoloration, misaligned teeth. You can basically get a brand new smile.
Wow, they sound pretty transformative.
They can be. A lot of people choose them for a more Hollywood smile, but they can also be great for fixing dental issues that affect both looks and function.
So it's not just about aesthetic. Veneers can actually improve oral health, too.
Exact. Say you have a chipped tooth that's causing you discomfort or making it hard to bite and chew. A veneer can restore the tooth's shape and function.
That makes sense. Okay, let's move on to another popular procedure. Dental implants. What are those and how do they work?
Dental implants are basically artificial tooth roots that are surgically placed into your jawbone. They're usually made of titanium, which is a biocompatible material, meaning it can fuse with your bone over time. This creates a really stable base for a prosthetic tooth or crown.
So it's like having a permanent replacement for a missing tooth.
In a way, yeah. But unlike dentures, which just sit on your gums, implants are anchored to your jawbone. So they're much more stable, comfortable, and natural looking.
That sounds pretty amazing, especially for people who have lost teeth.
It can be life-changing for some people. Implants not only restore your smile, but also help preserve your jawbone and prevent your other teeth from shifting. It's a long-term solution that can really improve your oral health and quality of life.
Wow. Dental implants really are a game changer.
Yeah.
Okay, let's circle back to something we touched on earlier. The connection between oral health and overall health. We talked about gum disease and heart disease, but what other links are there?
Well, research has shown that poor oral health can be associated with a whole range of conditions. Diabetes, respiratory diseases, even some types of cancer.
Okay, let's start with diabetes. How does oral health play a role in that?
People with diabetes are more susceptible to infections, including gum disease. High blood sugar can weaken your immune system, making it harder to fight off bacteria in your mouth. And here's the thing, gum disease can actually make it harder to control your blood sugar levels.
So it's like a vicious cycle.
Exactly. That's why good oral hygiene is so important for people with diabetes.
What about respiratory disease? How are those connected to oral health?
Well, think about it. Bacteria from your mouth can be inhaled into your lungs. That can lead to infections like pneumonia or bronchitis, especially if your immune system is already weakened or you have a lung condition.
So brushing and flossing could actually help prevent respiratory problems.
It could, yeah. By keeping the bacteria levels in your mouth under control, you're also helping protect your respiratory system.
Wow, that's incredible. And what about the connection between oral health and cancer?
We're still learning more about that, but some studies have suggested a link between poor oral health and certain types of cancer, including pancreatic cancer and oral cancer. It's thought that chronic inflammation in the mouth might play a role.
Okay, this is all starting to sound a bit scary.
I know it can seem overwhelming, but the good news is, by taking good care of your oral health, you're taking proactive steps to protect your overall health. It's a win-win.
That's a good way to look at it. So let's talk about the future. What advancements are on the horizon in dentistry? And how might they change the way we approach oral care?
Oh man, the future of dentistry is really exciting. For one thing, nanotechnology is being explored as a way to target and destroy bacteria at the microscopic level. That could totally revolutionize how we prevent and treat cavities and gum disease.
Nanobots fighting bacteria in our mouths. Sounds like something out of a sci-fi movie.
I know, right? But it's closer than you think. And we're also seeing amazing progress in stem cell therapies, which have the potential to regenerate damaged or lost teeth. Imagine growing new teeth from your own cells.
Wow, that would be incredible. And what about advancements in dental materials?
There are new biocompatible materials being developed that can mimic the properties of natural teeth, which means more durable and natural-looking And we're also seeing the rise of 3D printing, which lets us create custom-made dental prosthetics with amazing precision.
The future of dentistry is looking pretty bright.
It really is. And as technology keeps advancing, I think we'll see an even stronger emphasis on the connection between oral health and overall well-being. We're finally starting to understand how important the mouth is as part of our overall health picture.
All right, so we've gone from ancient Egyptians and their DIY toothpaste to the future of dentistry with nanobots battling bacteria. What a journey.
It has been, and we've only just scratched the surface of oral health, really.
Before we wrap up, there's one more thing from the book I wanted to touch on. Personalized oral care. Sounds so futuristic.
I know, right? But with all the advances in genetic testing these days, it's actually becoming a reality. We can analyze someone's genes and see if they're predisposed to certain oral health issues.
So like a blueprint for your mouth.
Exactly. And with that info, we can create a customized oral care plan. Someone genetically prone to gum disease, for example, might need more frequent cleanings or specific hygiene practices.
It's fascinating. It's like a proactive approach based on your individual needs.
Hey, and it goes beyond just genes. There are smart toothbrushes now that can track your brushing habits, give you feedback, even connect to your phone for personalized insight.
Wow, that's pretty high tech. It's like having a dental coach in your pocket.
It is. And as technology keeps evolving, we'll probably see even more personalized approaches to oral care. It's all about empowering people to take control of their own oral health.
I like that. Okay, before we finish this deep dive, I wanted to go back to something we talked about before. The connection between oral health and overall health. It's amazing how much they influence each other.
It really is. And the more research that comes out, the more we realize just how interconnected our bodies are.
It's like a domino effect. If one part's off, it can affect everything else.
Totally. And oral health is no exception. We talked about the links to heart disease, diabetes, respiratory problems.
Right. And even certain cancers. It's pretty mind-blowing.
It is. But the takeaway here is that by taking care of our oral health, we're not just protecting our teeth and gums, we're investing in our overall well-being.
It's like a ripple effect, right? Those good habits spread out.
Exactly. And the opposite is true too. Neglecting your oral health can have some serious consequences.
So what are your top tips for staying on top of our oral health game?
Consistency and prevention are key. Brushing twice a day, flossing daily, regular dental checkups, those are the essentials.
Okay, the basics. But is there anything else we can do to really level up our oral health routine?
Being mindful of your diet is huge.
Yeah.
Managing stress, avoiding things like smoking, those all play a role too. And don't forget to stay informed about new developments in oral health. knowledge is power.
Great advice. So it sounds like a holistic approach is really the best way to go.
Absolutely. Oral health isn't just about your mouth, it's about your entire body.
Well, I think we've covered just about everything in this deep dive into oral health. Any final thoughts for our listeners?
Just remember, a healthy mouth is a sign of a healthy you. By prioritizing your oral health, you're investing in your overall well-being and setting yourself up for a healthier future. And if you're interested in diving even deeper into this topic, I highly recommend checking out the book, The History and Science of Oral Hygiene. It's available on Amazon Kindle and Google Play Books.
Great advice. I know we'll be brushing and flossing with a whole new perspective after this deep dive. Thanks for joining us.